Good evening to all. My name is Eric Sabbah. I'm a cardiologist in Longueuil, in the vicinity of Montreal. And for a few months now, I have been vocal on Facebook and my YouTube channel about the COVID-19 situation, giving my personal opinions, reading a lot on the subject, and trying to give my personal impressions and sometimes recommendations to my followers who grew during that time. So my followers are French speaking. I've done all my casts in French, but I have been asked to talk in English. So this is probably one of the few or the only time that I will talk in English in order to give my viewpoint, some kind of my personal impression at this point of time. We're July 12th in Montreal, so obviously the situation progresses, and I will speak mostly about our local situation, but I want to address my biggest fear. And my biggest fear right now is scrolling on Facebook, scrolling on YouTube, and seeing all those videos that are getting the most views. And these videos are occupied by people who are completely against every government decision, guidance, against the World Health Association guidance, against protecting themselves and their neighbors by wearing masks, against distancing, against the search of a vaccine, and mainly they're all pro hydroxychloroquine. And it sounds to me like there is a big group vocalizing and getting a lot of attention. And this is dangerous because the real fake news is coming out of their mouths. So these people are criticizing the media, criticizing the physicians, and basically ignoring the fact that we're in a pandemic and that every step of the way, what someone does, how someone uh, behaves, uh, is affecting everybody else in the community. And if this is not understood, obviously, how can we follow guidelines? And there seems to be some kind of a mini rebellion against distancing, and people have lived the confinement difficultly and are coming out of it in a very vocal way, and there seems to be a danger associated with this. So I really wanted to give my impressions about these fake news, these real fake news that are going around, and here are my viewpoints. So if you hear these words in a video, beware. We are not in a pandemic. This coronavirus is no more dangerous than the common flu. Nobody died from COVID. Hydroxychloroquine is the treatment, and Big Pharma is controlling doctors not to prescribe this cheap drug. World Health Association, media, governments, following whose recommendations are all bought out by the Bill Gates Foundation and brainwashed with a fear campaign. Masks are useless or dangerous. Confinement is criminal. Social distancing unnecessary. The virus is gone. No second wave to expect. Sweden got it right. All this is circulating on the net. All this is getting major attention. And all this is completely false. We are not in a pandemic. I guess this picture sums it all up. No more dangerous than the flu. COVID-19 is no more dangerous than the flu, really? We are only beginning to understand this disease, which has a very wide spectrum of symptoms. We are now seeing patients having even chronic symptoms after they're declared cured. This coronavirus is at least 4 times more lethal than the flu, and this is minimally. Plus, we have absolutely no vaccine to prevent its widespread contagion. So there's no reasonable way to compare this to the common flu. And surprisingly, microbiologists did that. And I'm talking in particular Dr. Dizzy Harwood from France, who started everything. Have you heard with the common flu before? Patients suffering from a cytokine storm, from multiple thromboembolic complications. There is a constant threat of overflowing the ICU capacity in this pandemic. And when that happens, the mortality is increased to a point that it's 20 times worse than the mortality of the common flu in certain countries. This is a chart of the common symptoms of COVID-19 for the acute phase and the post-COVID-19 follow-up. After 2 months of follow-up, you can see that about 40% of patients still complain of fatigue and shortness of breath, plus other symptoms, including chest pain. So this is not seen with the common flu. This disease is only beginning to show its full capacity. Nobody died from COVID, really? COVID is a very long-running disease with prolonged hospitalizations in the ICU for many patients. All the complications that arrive have been confirmed many times in autopsies to be due to multiple multi-organ thromboembolic complications. And this is very different than the flu. Although more than 85% of deaths occur in older and fragile patients, sad stories are numerous, including healthy younger patients, including health personnel. I believe that all this movement against the recommendations that are necessary to contain this disease started after Dr. Dizzy Harwood, microbiologist, expressed to his students and to the world how benign COVID-19 is. Let me show you this. So for 13 years, Dr. Raoult tried to position hydroxychloroquine as a usage against a virus disease. He obtained positive data in test tubes, but negative data were numerous time and time again in animal studies and human studies. The studies were done with HIV virus, SARS, Ebola, dengue, chikungunya, and the flu, influenza. Hydroxychloroquine never changed the prognosis in humans. Yet, after a very small publication from China, which is here written in French, but I can basically translate. This is the full letter that was published in a small bioscience journal in China, 18th of February 2020. And it says basically the results over 100 patients demonstrated superiority of hydroxychloroquine over standard treatment, and it was well tolerated. So the experts asked the government to authorize hydroxychloroquine for the use in COVID-19. We have no serious data here, no numbers. We have no idea who the patients were. This is certainly not a serious publication. Yet, Dr. Raoult's reaction to these results was quite memorable. You can catch this on YouTube, the integrality of his speech to his students, saying that the Chinese have tested hydroxychloroquine and have found excellent results. And this medication should be now prescribed to every patient who is diagnosed with the coronavirus, and with very good results. And he ends by saying and making everybody laugh that this is the simplest virus to treat, and we should not worry about anything else from that moment on. So this, I think, is what started all this movement that ends up not believing that we're in a pandemic and that the situation is certainly more critical than what is being um suggested by this conclusion. Well, Dr. Raoult added three studies after that, coming out of Marseille, where his hospital is. The first two studies were small studies that included a total of 120 patients for the two studies. They were not randomized. There was no control group. So he just administered the medication to these patients and observed what happened to them. The average time after the medication was started was 5 days after beginning of the symptoms, so probably around 10 days after the initial contact, meaning that there was only a few days left. Now that we understand the disease and we know it better today, we know that without any treatment, these patients were started on medication with only a few days left of disease to go through for the majority. And he concluded that 93% of patients had no more viral charge after 8 days of treatment. So looking at this today, are we even surprised that there is such a result, since we're obtaining basically the same or better now without any medication? In his study, 12 out of 80 needed oxygen and 3 out of 80 intensive care, and we have absolutely no information about the patients after 10 days of follow-up. So it is one thing to say that the patient has no more viral charge, but we know very well in this disease that the virus after 10 days is not the problem, but the immune system of a patient is the problem. A patient can be very sick in intensive care and not shed any more virus, but the disease is still there. So, and he pushes that all the way to compare his results to a Chinese study that came out of China, the first study that had a 20% death rate. And he mentions that his 1.2% death rate is clearly superior, and that hydroxychloroquine is the reason for this. We know today, obviously, that 20% death rate means that these patients in China were included in that study and were very, very sick, sicker than the ones included in Dr. Raoult's study, obviously, because there is no 20% death rate today without any medication. The third study of Dr. Raoult was retrospective. So he looked at 3,737 patients that he treated. And the average age of the patients he presented was 45 years old, from 28 to 62 years. And he was glad to announce that the mortality was only 0.9%. I have a moment of reflection now, and if I tell you today that you are 45 years old and you have 1% chance of mortality with that disease, I think that most of you would freak out. So this is not the case. Right now, I think we're down to about 0.5% of mortality globally for that disease. And when you're 45 or even 28, as in this study, it's even less, and that is without any treatment. About a month after the Chinese recommendations, the Chinese came out with this recommendation not to treat patients with hydroxychloroquine above 65 years old because of side effects, heart side effects, visual side effects, kidney, liver side effects. So this medication is not benign, and it became obvious that older patients should not be treated with it. And actually, older patients are the ones who need to be treated, and the only ones who need to be treated, since they're the ones dying from this disease. In my book, this poor data globally for hydroxychloroquine does not qualify as a treatment. Randomized data was up to now inconclusive, so we're still awaiting for clearer a picture of this medication. But this drama made place to what we're living now, to the movement against pharma, to the movement against certain physicians like me who are recommending what the World Health Organization is recommending and what our governments are recommending, which is the only way to control right now the disease with social distancing. So, World Health Organization, media, governments are all bought by the Bill Gates Foundation and brainwashed by a fear campaign. Whatever. I can guarantee you that I have no financial comeback for whatever I've been saying. It is absolutely normal to readjust recommendations as we go because this is a new disease and we're learning. Everybody needs to come and see a guided tour of an ICU unit to know exactly what it is to be sick with that disease and what it is to be abandoned by your family. All those conspiracy theories will cost us our precious efforts. What do I have to say about masks, social distancing, the Sweden experience? On the left side, you have studies. This is not invented. You have studies about masks as a prevention for the spread of viral disease. And these studies are not all positive, but they all tend to be positive, some of them more than others. And the global results are clearly positive. So, what we call the meta analysis favors completely the wear of the mask to prevent viral spreading. You can just look at the Asian countries who do this for years now, how quickly they maintained this first wave compared to America. And there is no question in my mind that masks are useful. Now, for those who say that the Sweden experience was convincing and that Sweden was right, yes, I agree that psychologically, they come out of this probably um, in a more positive way, in a more positive frame of mind. But the price to pay, to my regard, was just too high. If you look on the right side, I give you the curves of deaths from COVID in neighboring countries, Norway, Finland, and Denmark. And you have the Sweden curve, which is completely exploded, about 4 to 5 times more deaths than their neighbors. This is what happens when you don't social distance yourself enough. You will hit a higher peak than your neighbors. Obviously, this peak will go down. Uh, the Sweden curve today is way down, even more down than the United States, which actually is not coming down at all. You cannot compare Sweden to the United States. United States is behaving as many different countries. The New York and New Jersey experiment was one thing, and now Florida, Texas, California, Arizona is the follow through. This is still their first wave. When you put all this together, some waves have gone down, some waves are going up, but globally for the country, it doesn't look good. It seems that that first wave is never ending. In Sweden, the wave is down. The peak was very high, but the wave is now better than what the United States are living, simply because the country is smaller, the population is more spread out. There is your opinion about social distancing. Finally, the virus is gone and no second wave is to be expected. And this, to my opinion, today is also wrong. I was not always with that opinion. I believed that there would be wavelets, small waves after the first big wave. But now looking at how people are reacting and how people are not disciplining themselves and are not nervous about the virus, I have a tendency to believe that uh, the second wave that is coming, because it is coming, will maybe be at least as hard or maybe harder than the first. So this is what Israel is living right now in the lower picture. You see that Israel was very good to control the first peak, the first wave, and for about a month had no cases to declare or minimal cases. And they're well into now their second wave, and the peak is yet to come. Unfortunately, same story with Australia. They were very quiet for a while, and we can say right now that a second wave has started. We don't know how far it's going to go. Same thing for Japan if you look at the picture. So the second wave uh, does exist, and we have signals already around the world. Obviously, the United States are still dealing with their very strong first wave. I mean, we're worried about what's going to happen in the States right now that are gradually diagnosing more and more patients. Initially, we didn't see an impact in hospitalizations and mortality because the patients were younger than the first few months. But in the last few days, we definitely see a peak of hospitalizations. The ICUs are getting close to capacity in certain states, and the mortality is creeping up. So this is the real thing. It's hitting strong. And if we don't if we don't pull our act together, we might be hit a second time, and the second time might be worse. In Montreal, we're still in a good place. We have about, in Quebec and around Montreal, mostly around 100 cases a day. After a couple of weeks below 100 cases, we're up to 100 cases a day. But this seems to be a stable number for the past week. Although around me personally, in events that occurred in my community, I was surprised to see in a small wedding of 50 people, one that came out positive with COVID-19. So it seems to be probably more spread in the community than this number is suggesting. So I'm not sure that we're testing enough and testing enough to give us the full picture of the situation in Montreal. But clearly in the hospitals, it's still quiet. We're still in a good place. ICUs are quiet. If we grab this chance, if we grab and compare ourselves and realize what's going on elsewhere, we might avoid uh, overflow in hospitals. We did it the first time around, and I hope and pray that we're going to do it once again. So, this is my message to you. Please look at everything I presented to you and follow the guidelines for our whole population's benefit. Thank you very much.